Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Kevin King. He's a healthcare executive. Today's Kevin MD article is How to Stay Safe from Back to School Illnesses. Kevin, welcome to the show.
Great to be here. Thank you for inviting me.
All right. So, just briefly share your story and journey, then we'll talk about your Kevin MD article.
Hi. Well, I grew up in Athens, Ohio, and that's where Ohio University is. I received a bachelor's degree in zoology and microbiology there. But most importantly, I had the experience of working at a startup biotech company that had brought a diagnostic device to market. And so that sparked a lifelong interest in infectious diseases and diagnostic devices. I then got a PhD and did two postdoc research positions and then made the transition into industry working in a contract research organization where I led a team of scientists that were developing diagnostics devices to detect infectious diseases, including respiratory products. I then had the opportunity to return to Ohio and work for a company that was acquired by QuidelOrtho, and that's the company that I work at now. I'm the Senior Director of Scientific Affairs. That's globally for our respiratory, point of care, and cardiometabolic products. In that role, I develop educational opportunities and teach our customers about our products.
All right. So your Kevin MD article, very relevant at this time of year. A lot of our school-age children are dealing with respiratory illnesses. Your article, How to Stay Safe from Back to School Illnesses. For those who didn't get a chance to read it, tell us what it's about.
Yeah, well, the article stemmed from my observation, both in my own household when our kids go back to school, and from the literature that this is a time, although it's not, as epidemiologists would say, the start of the winter respiratory season, it certainly ramps up the amount of respiratory illnesses like strep throat, influenza, RSV, COVID, as students return to school. I wanted to highlight that in the article that prevention is not just about taking the common precautions that we're all aware of, like washing our hands, vaccines, covering your nose and mouth, but also the importance of leveraging diagnostics testing early on, following symptom onset, not just so patients get the proper treatment, but also to help prevent the spread of illnesses within your community. So the piece came together through a lens of diagnostics and surveillance with a goal to emphasize how rapid diagnostics and the data can help us anticipate and respond more effectively to what's coming later in the respiratory season. For example, tracking increasing school absences, wastewater, looking at Southern Hemisphere illness trends, all can provide early signals of which viruses are likely circulating in your community. When this knowledge is shared, so for instance, from local health departments, it provides insights that can allow clinicians, schools, and families to act earlier and together to help limit the community spread of these illnesses.
Now, I'm sure a lot of families and pediatricians are familiar with these point of care testing modalities, specifically with, say, strep testing. Tell us some other common respiratory diseases that we have point of care diagnostic testing for.
Yeah, certainly for strep, but also for influenza, respiratory syncytial virus or RSV, and COVID-19, of course. And we're all familiar with kind of the rapid at-home tests. There are similar rapid and accurate tests available wherever you seek care.
And in your article, you mentioned when it comes to these rapid diagnostics, it could be either antigen versus molecular based. Can you tell us the distinction between the two?
Sure, the antigen products are typically more rapid, although molecular products are becoming as rapid as the antigen products, but they're different in what they detect. Molecular products detect some DNA or RNA signature and then amplify that signal to be detected of the virus itself, whereas The antigen products are testing a protein component that might be on the surface of the virus. And in general, molecular tests are considered to be more accurate.
All right, so run us through a few scenarios. Let's say for those parents who may be listening to you and their school-aged children are coming back home with some upper respiratory symptoms, give us some scenarios where these parents would consider some type of rapid diagnostic tests.
Well, certainly, if you have and keep the at-home tests for you, that's a place to do those tests even at your home. And there are combo tests now for both COVID and flu, the most predominant ones as we head into the respiratory season. If your child has a fever, that's one of the key symptoms that you would want to test early for. But I think the importance of testing early and not just waiting to see what further symptoms develop or decide at a later point to go to an urgent care or your primary care physician is in part because there are medicines for both of these. So there are prescriptions that can help reduce symptoms and ultimately prevent the spread to more vulnerable communities. And it's sometimes we don't realize how vulnerable the folks that we interact with are, like aunts and uncles, grandparents, that those types of folks that you come in contact with. And it's really important. This helps prevent the spread of the disease, but also knowing that you have a virus is also important in terms of making sure that you're not prescribed an antibiotic that's not going to work for a virus. So getting that knowledge is really important also for antibiotic stewardship.
Now, which of these tests are available over the counter versus which tests are available only through your pediatrician's or urgent care center office?
There are types of antigen and molecular products that are available over the counter. Some of the molecular products, though, are more in a scenario in which you would have to do a collection at home and then send the sample in. But both antigen and molecular products are available at most urgent cares or primary care physicians, especially small physicians' office laboratories.
And specifically, these tests for things like influenza and RSV
Yes, and COVID.
and COVID. And then how about available over the counter? Are they available over the counter? Obviously, we have the rapid COVID test, but what about things like influenza and RSV?
Absolutely. Influenza and COVID tests are available. Even combo tests are available. So one test for both. I'm not aware whether there are RSV over-the-counter tests available. So that's probably something that you need to go to your doctor for.
So you mentioned earlier about some of the epidemiological implications of rapid testing. And you mentioned in your article that monitoring school absenteeism rates can predict outbreaks. So talk more about that.
Yeah, I think when you start to see higher levels of absenteeism, or that if your community is monitoring wastewater for the detection of any of these viruses and those start to go up, those are good indicators of what's coming or that something is building. And so that can help inform a clinician. If you're aware of that knowledge, that can help inform the clinician what kinds of tests would make sense to do in coordination with the symptoms that you're observing.
Now, the government and the regulatory authorities like the CDC, they already track things like ER visits and, like you said, wastewater diagnostic results. So tell us the missing piece or the additional puzzle piece that point of care diagnostic testing can add to all that data.
Yeah, and so I would clarify that we're also in a time now because of the shutdown that not all of that
Mm.
data is available and being released from the CDC. And that's national data and may look at your state, but may not inform you about what's going on in your community. So continuing to perform diagnostic tests, and if your healthcare system or your laboratory information system can be used to track what the positivity rate of these tests are, that can help inform you what's going on much closer to where you're actually practicing.
Now, can you give us a real world example of how point of care diagnostic testing can inform disease trends? Just give us a practical example of how that happened in the past.
Well, during the COVID pandemic, wastewater in local communities was a factor when healthcare departments were assessing recommendations for mask wearing or things like that. Additional precautions to be taken when it appears that something is emerging.
And what do we have to look forward to? We've talked about things like COVID, RSV, influenza. So, down the point of care diagnostic test pipeline, what do we have to look forward to?
I think it's probably more accurate and rapid molecular products that are able to be used closer to the point of care. And those products may be being able to test for more than one respiratory, so multiplexed, being able to test for more than one respiratory product at a time. Those are available now in certain laboratories, but moving closer to the point of care and being able to be utilized in urgent cares or even retail outlets. If you see, clinics in those research outlets, even in those environments, the more accurate testing can be moved closer to the patient there.
And how about in terms of costs? Again, talking with some of the parents who may be listening to this, what can they expect for costs if they were to purchase an over-the-counter point of care diagnostic test from, say, a
Well,
drugstore?
unfortunately, I'm not familiar with the exact cost of those. Only what I see when I go. I don't know what they are in other locations, but I've seen some over-the-counter products, even those that test for both COVID and flu, two tests for about $25.
And in terms of different types of brands, anything that parents should look out for in drugstores, or do they all work in similar ways?
Well, I think they all work in similar ways. It's more when you get to those tests that are conducted in either in your physician's office or in urgent care, where choices can be made to utilize either more accurate tests or more rapid tests, depending on what the needed workflow in that environment is.
We're talking to Kevin King, healthcare executive. Today's Kevin MD article is How to Stay Safe from Back to School Illnesses. Kevin, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, certainly. I think one of the key take-home messages that I would say is that it is possible to minimize the spread of respiratory illnesses during the back to school season, but it's about more than managing the symptoms of the individual patients. It's about staying ahead of them. So by combining rapid diagnostics and data, illness outbreaks can be identified, and then impacts on communities can be diminished through timely diagnosis, accurate treatment, and all of that to prevent the spread of and ballooning into larger seasonal outbreaks, especially protecting with a goal in mind to help protect those vulnerable communities as well.
Kevin, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you for having me.